I'll just give an additional thumbs up to care opinion, because we use that now with our students at the University of Salford. All of the allied health professions are taught to use care opinions by way of teaching them how to communicate in a professional way online. So great, care opinions team have been so professional helping us with that. So just an endorsement there for us as well. Okay, well, my talk is going to cover the use of social media both in the research context and also in the practice context, out in practice, in clinical practice. And I will try to discuss these as two slightly separate contexts, because we've got different degrees of success and different things that we've learned from those different contexts. However, the illustration that I'll use to talk about those two things is combined within one project, which we've called the Women Project. So in a way, it's a little bit difficult to, to separate the two concepts out, but I'll try to do that, because I think what I'll hopefully demonstrate through this talk is it's actually easier to engage patients and practitioners together online in a research project than it is out in the public domain in a clinical type of project. But we'll see how we go on with that. So I'm just going to take you quickly through the journey of the Women Project. We started in 2013, so it's about a 5-year-old project. And we had a question right at the beginning of the project, which involved looking at patient information for breast screening. So this is about breast screening and giving patients enough information. And we had an idea that we wanted to produce some online information, but not just information. We wanted to use a social media type of information forum. And so I didn't know too much about social media, and I decided that it would be really, really important to get a multi-professional group together, and in particular to get patients on that group. So in 2013, we got a group together. We did some user-centred design work. We created the Women Hub, which went live in 2015. In 2016, we started to do some implementation work to make sure that practitioners and employers were behind what we were trying to do, because there was no point getting women to go online to talk to practitioners if there was no women to talk to them, which is what the previous group have just illustrated with a lot of examples of that. Particularly, I'm not sure if you're aware that NHS Choices have got Health Unlocked as their social media platform. So for all the pathologies that you want to go online and look up conditions, you do have the opportunity to chat. But those chat groups are not, to my understanding, and certainly not within the area that I'm interested in, they're not moderated in any way, and they're not engaged with by health professionals. It tends to be patients talking to each other. And then we're now at 2017, and we're at an evaluation stage, and we're also at a point where we're really doing a lot of interesting work around using digital media to promote and target specific groups. I'll tell you a little bit about that at the end. But the main purpose here is not to try to increase the numbers of women going for breast screening, but it's to give patients information and information that will help them to make choices and decisions about whether to go for breast screening, because it's a really contentious area with lots of information out in the media about the pros and the cons of breast screening. So we wanted to try and help women with that sort of information. During the 5 years, we have, as a research group, we've made sure that all of our work has been evaluated, written up, shared, and you'll see there that we've got book chapters, peer-reviewed articles, which I'll allude to as we go through. And we were really proud to be awarded the College of Radiographers Team of the Year last year for our Women Project. And we were also shortlisted for the Health Innovations Award last year as well. So I think we've got a fairly robust project in terms of the Women Project. So I mentioned that we've got a multi-professional team. A few of the team are sitting in the room here. That was really key, and that again was mentioned by the previous group. This is social media is where multiple disciplines start to interact. We have got media psychologists in there. We've got business marketing experts, digital marketing experts, clinical practitioners, and most importantly, users, so service users, patients, members of the public, who need to tell us what it is they want. There's no point us as academics sitting there thinking we'll design some patient information hub if it's not what people want. So it's really important that we got multiple groups involved in this team. So I mentioned this started off with a project in 2012-13 where we were asking women what they thought about the pain during mammography. And I don't know if anybody's had a mammogram in the room, but you can imagine what it's like to have your breast squashed between two plates. And so we were doing some work around what perceptions of pain were. And out of that work came the notion that actually the information that patients get is this unidirectional information that people have alluded to this morning that comes from the NHS breast screening programme, that's in a leaflet, hard copy format. Actually, it is online now, but there's no opportunity to go back and ask further questions. And it's what we feel people want to know, and it's full of quantitative information about risks, and it is quite off-putting. And our study showed that actually women felt really poorly informed about what breast screening was about. As a result of that increased their anxiety, and that increases their perceptions of pain. And so there were some links to patient information. And again, like I think it was Caroline who mentioned earlier on, people prefer word of mouth when they're trying to find information about an intervention or a procedure such as breast screening. So that, coupled with Ofcom statistics that at the time suggested that women in that particular age group were the growing group that were starting to use social media. They had the biggest increase in activity over the last few years. And the NHS communication strategy, The Power of Information, that came out in 2012, which advocates the use of online methods for practitioners to talk to patients. We thought, right, well, that's what we need to do. We need to produce some sort of social media hub where patients can talk to patients, can talk to practitioners, and we'll use social media. That's perfect. That's what we need to do. But how did we address this? How are we going to address this? What sort of content would we need on there? What format would it take? And the only way we knew that, we would have the answers to that, was to get users involved. So we used a user-centred design approach. And so we have this grand notion as academics, we'll do some focus groups. We'll get all these women to the university, these women that are 45 years old, that haven't got anything better to do with their lives, come to the university and sit down and tell us what they want on the breast screening hub. And as you might imagine, we failed so dramatically at trying to get women to come into focus groups because they're just too busy. We went out to the community to try to get women together. Similarly, they were busy, and we even went to Morrison's, who were very kind and got us a staff room and got a few members of staff to sign up to come and talk to us. But they were very frightened of these academic women that were coming to talk to them about online social media. So they all bombed out of it. So we had to drop that. So we had a bit of a light bulb moment, and we thought, well, this is a social media project. We should be using social media to engage people in the actual research itself. So that's what we did. We put a closed Facebook group together, and we used our own social media networks to distribute adverts and blogs to get women to come onto a closed Facebook group to talk about breast screening and what they might want in a breast screening hub. And we did some analysis. We looked at how many people signed up to the group. And during the period of analysis, which was a six-month period while we had that closed Facebook group talking about breast screening, we had 89 participants sign up. We had more in the end, but just over the 6 months of analysis, we had 89 women. And during that 6-month period, we analysed all of the posts, and there were 206 posts, 1,124 comments, 570 likes, and 67 of those 89 participants were actively involved in discussions. And we developed a real community of women talking not just about breast screening, but about lots of other things that we were interested in, because that is one of the key things if you want to start to develop a community of practice online, is to not, especially if you're using it in research, it's not just to start by firing questions out. Okay, what do you want in a hub? Is to start to develop relationships just as you would in any social encounter. So there were lots of offline conversations. Remember, we did this in order to try to give women an opportunity to be involved in our research at a time and place that was convenient for them. So we analysed when they participated, and they participated, the resolution on this is not particularly good, but those are days of the week, so they participated every day of the week. And those are hours of the day. So you can see people are participating every hour. We've even got people participating at 2 o'clock and 3 o'clock in the morning. And as a 50-odd-year-old woman, I can tell you that you do tend to wake up at that time of the morning, you know, with hormones doing all sorts of things. So we were online talking to each other about breast screening and other women's sorts of things. But interestingly, the most active time is 8 o'clock in the evening for women to go onto Facebook. So it was really useful as a research tool. We then analysed these posts, and I'd like to thank Kathy Yeo, who's in the room somewhere. Kathy, stick your hand up. Yeah, Kathy was my an analyst in this, and what we did was we analysed all of the posts to identify what themes there were, to find out what people talked about, and therefore what would go into our final hub. And we did a framework analysis, so we were able to separate out what different groups wanted: practitioners, patients, other healthcare professionals, not just mammographers, so a whole range of different people. And that enabled us to make the hub fairly nuanced in terms of the different areas that might be on the hub for people to go to. And what did we find? Well, as we thought, women, in terms of features, really want to communicate. They don't want to be talked at, they want to communicate with other women, they want to communicate with other health professionals, but they want this idea of personal experience balanced with an evidence-based, and we've heard a bit about that this morning, that patient experience, patient stories are just important in terms of valid information as our more traditional evidence-based research type information when women are coming to make decisions about healthcare. And I think we're in that sort of change in our perception of what we term and what we come to reify as accepted knowledge now, which is a good thing, so different types of knowledge. The key topics are listed there. No surprises there. These are the things that women want on a hub in terms of information. So something about what screening is as a concept in general, all the way through to the actual mammogram itself, and also what happens after the examination. We have heard again this morning about gaps during a patient's journey in a various encounter, and usually the bit between an intervention and then what happens next is that sort of gappy area where they've got nobody to talk to. And we found that as well. And this has just been written up and accepted in an open access journal, the Journal of Medical Internet Research for Cancer. So you can access that, find out a little bit more. So here is the hub itself. That's what it looks like. Actually, it's been updated a little bit since that last slide, because we've now got patient stories on there as well. But we've got the opportunity, we've got forums where patients can talk to practitioners. We've also got forums where practitioners can just talk to practitioners themselves, which is more of a closed forum. This forum where patients talk to practitioners is open in terms of being able to read the posts, but if you want to post, you have to log in and register. Now, that has caused some problems, but we did that because that's what women on the closed Facebook group said they wanted. They want an element of privacy, but that adds clunkiness to the whole conversation. And you'll find in a moment that actually our Facebook site that we've set up in addition to the hub for sharing information has been a lot more successful for the sharing of stories. Now, this additional Facebook group well, we've got Twitter as well. Let me just tell you about Twitter first. We've got a sort of a sister Twitter account, and we've got something like 600 and odd followers on there now. But we've also decided, because Facebook was so successful, we will still use Facebook, but we've opened it up. So we've got 2 separate Facebook accounts. We've got the closed one, which was just for research, and now this is our open Facebook page, which anybody can go on to talk about breast screening. So the Twitter and the Facebook feed into the Women Hub. So you go into the Women Hub, you can see both Facebook and Twitter. And the reason for that is that we all use different platforms, we all have different preferences, and we didn't want to pin people down just to one. And if people want to leave an open message there, that's fine. If they want to leave something more closed on the closed hub, then that's fine as well. And you can't read this story here, but this was a lovely story on the Facebook group, where the open Facebook page, where somebody told us all about the fact that she'd just been for a mammogram and she was recalled and she was really worried, and there were lots of people posting up to sort of encourage her to go back and not to be worried, and then she followed it up with what happened next, and so there was a real sense of community there about this woman's breast screening journey. Remember, patients said they wanted to be able to read experiences of other women, and they also wanted to post their experiences. And we found somebody on the Facebook page who had said that she'd had great experience of mammogram. We contacted her through the Facebook and we said, do you want to put it into a blog? And well, she was amazed at being asked. She was really, really pleased that she'd been asked to write a blog. It gives people voice. We've heard about anonymity this morning. That is okay, but we mustn't forget that actually the benefit of social media is empowerment of the public and giving people voice. And we mustn't always assume people want to be anonymous. Some do, and as health professionals we have to be very careful about that. But there's a lot of people out there that don't want to be anonymous. They want to share their stories, and that was the case here for Jean Phillips, who was one of our patients who wanted to talk about her experience. In terms of information, we've got a drop-down box, and all of the subjects there are the subjects that patients told us on the closed Facebook group they wanted. So we've really been able to produce a hub, a resource that we feel is designed by people for people. So designed by the public for the public, and designed by practitioners for practitioners. So that's where we're at in terms of the hub. It was launched in 2015. 2016 brought us some challenges, and this is where we wanted to start to implement it. It was really important, as I say, that we get practitioners accepting this. Patients clearly are accepting it. Patients are miles ahead of practitioners in terms of their eagerness to go online and talk and get information about health. But we weren't sure whether that was the case for practitioners. And there are some systematic reviews that have been published in the States, actually, looking at people's practitioners' attitudes to using social media. And all the things that you might imagine are apparent in that literature. Anxieties around professionalism, being shown up as not having knowledge that they should have because it's all online and people can see it, being struck off for doing something wrong, risk management, managers are all worried about that. So we did some workshops with mammography practitioners around the country to find out if that was truly the case here in this country with our mammographers. So we said, look, we produced this great resource for you. Some of you have been involved in helping us. Patients have been involved. Will you use it? We also looked at employers' policies, and Bev Scragg at the front here is one of our team who did most of the work around looking at policies. And we looked at, we tried to look at 10 policies, communication policies on social media from the Northwest. Trusts that had breast screening, because we were keeping within the breast screening context. And we managed to get hold of 9. The 10th one wasn't available. And we did some content analysis, and that was really quite interesting. And I'll tell you about that in a moment. Social media brings public and practitioners together, doesn't it? Well, actually, patients want to use it. they want to use it to support their decisions and to talk to practitioners and to affect change, as we've seen in the last group. But what we found with those two pieces of work is that practitioners are still anxious. So we had these 4 workshop groups across the country. We talked to 80, 90 practitioners, and the outcome was that, yeah, it's a great site, but I'm not sure I want to go on there. I even had managers contacting me saying, one of my staff wants to come on one of your workshops, but I told her she can't come because I'm worried that she's going to say something she shouldn't do when she goes online. And I said, well, okay, but are you not worried if she's lacking knowledge about something, are you not worried she's going to say something to a patient in a face-to-face encounter? Well, yeah, but nobody'd know about that because it's just face-to-face. These are the sorts of things that we were being told. So there is still an awful lot of work to do around that. And when we investigated the employers' policies in the North West, 8 out of the 9 were either discouraging or prohibitive in tone in terms of using social media. There was only one that said, yes, go ahead and use it, and not only that, we'll give you some training. So there's an awful lot of work to be done to get the practitioners involved as well in the work that we've done. And it might just be the breast screening context that's causing these anxieties, because breast screening is very tightly connected to national uptake figures. It's really important that we don't put women off attending for breast screening, because each unit has got to demonstrate 70% uptake in breast screening. So we're talking about a slightly different issue in breast screening. We're talking about well people compared to communities of people who've got a chronic illness that need to support each other. So they may be some of the issues that are underpinning our findings here. Again, these papers have been written up so you can find out a little bit more there. So we've used social media to produce a hub. We've used it in research. It's been successful. We've investigated the use of social media by practitioners. We've got some anxieties. This is now an interesting next step, which is the final step that we're going to be looking at, and that is how can we use social media now as a marketing tool. And somebody mentioned earlier on, are you not worried about social marketing and adverts going onto Facebook and targeting people? And we're worried there in terms of external companies, trying to do their marketing. But actually, we can use, as health providers, we can use that notion, that concept of digital marketing to increase uptake in something like the breast screening arena, and not just breast screening, any screening, where we want patients to start to consider making choices, and they have to make choices in order to decide to go for a particular investigation. Then we can direct them to information that they wouldn't necessarily have had the opportunity to access before, or wouldn't have known was available. And so we've started to use Facebook ads to target low uptake areas within the Northwest region with our Women Hub. And then we can have a look on our Women Hub to see whether people have come via those ads. So it's really quite clever, and this is where we've got the digital marketing people on board, because this is something I know nothing about as a radiographer. I know how to x-ray the women. I don't know about how to get them through these digital means. So watch this space really with regard to digital marketing. This schematic really just illustrates that social media exists in lots and lots of different platforms, which somebody nicely illustrated in the last talk, and we all got up and said which ones we're using. And that's something that's really important to bear in mind if you are considering using social media in research or in developing your own communities and your own hubs, is to be aware where you can use it in the research cycle. And depending on where you use it and which patient population you're using, you need to decide which is the most appropriate social media tool. So if you're targeting a younger age group, if you're targeting cervical screening, for instance, you wouldn't necessarily go to Facebook. And the Ofcom statistics, Ofcom produced some really good statistics about which age groups are using which social media platforms, so that's a useful thing to do. But really, really important is up on number 7 there, and this is the research cycle, initiate, collaborate, get participants involved, collect some data, write up and disseminate. Disseminate is so important if you've got patients and involved and they're putting the time and effort into working with you to develop these things, is that you come back to the patients and say what it is you've done with their information. So again, you'd go to all of the relevant social media platforms to disseminate that information. And we are, I think we've got a lot of work to do to put research information into an accessible format, not just for patients. I don't want to undermine patients, but also practitioners. Research currently sits in these sort of academic writing, in academic textbooks, and they can be really difficult to access and consequently don't get read a lot of the time. So just to summarise, social media enables convenient patient and public involvement in user-centred design, and that if you use user-centred design, that makes sure that your outputs are relevant to the group that you've been working with. It can be used at all stages of the research cycle, but I think this is really important. The patients and public are ahead of the game. We've got a lot to do to get practitioners involved for a lot of various reasons, and one of the workshops, the workshop that Caroline and I will be running this afternoon, will be exploring a great idea that we've got to address that. So we hope you'll join us there. Thank you.
Slido up as well, please. Thank you so much, Leslie. It's fantastic. Yes, we have got ideas. We'd like to actually do something with all this enthusiasm and passion for engaging more health staff on social media. So if you can join us, we'd love you to. Any questions for Leslie? I know there's some. Do you want to pick a couple out there, Leslie?
Yeah, we did. We did a lot of work looking at what else had been done elsewhere. That's disappeared off. We looked at all the various sites. There wasn't anything that was just quite what we wanted. Macmillan do have a fantastic site for patients and discussions, but we felt that we wanted the opportunity to have blogs and things on there as well. So there was just a little bit more that our site does. Do you think staff are scared to use social media because their focus is too much on the risk and not on the benefit? Absolutely, it's too much on the risks and not on the benefits. And I think that just comes from the media in general. If you look at what does the media say about social media, we never hear about these great stories, that we've heard about today. Well, I will say never. They are dominated by negative stories rather than positive stories. So we've got a lot to do around that.
Any questions from the room? You wanted to put your hand up? No? Okay, that's great. Thank you very much, Leslie. Thank you.